So today we're going to be looking at the Illinois Opioid Crisis Action Plan. We're going to summarize it and then look at how it has been working since it was proposed in January of 2020. So the main goal of this action plan was to reduce opioid-related deaths by 1/3 in the next 3 years. So they looked at this by doing through 3 different objectives. The first one is prevention. One of the ways that they were trying to address prevention is through safer prescribing and distribution of opioids. So some of the examples of this was that prescribers must have appropriate licensing with a prescription monitoring program, and then more use of this program in general. Then evaluating the prescribers that can give higher doses, and then recommending that higher doses than what is recommended, and then the access to their practices, and then providing more education when renewing the license. And then another way is the education and decreasing stigma through more accessibility and resources, such as websites, helplines, programs in schools and communities that can help people to understand how these areas are impacted by the actual opioid usage. And then the next one is monitoring and communication, which can be done through data collection for different interventions, through different public reports, and then tracking overdoses in real time. The next objective was treatment and recovery. First, they wanted to increase access to care for individuals with opioid use disorder. So this can be through outpatient methadone treatments, medication-assisted treatments, updating trainings on and the policies regarding this, then looking at mental health and substance use treatments, such as the Help and Spoke model, and how this can impact different populations, such as pregnant women and newborns. And then the next one was to increase the number of diversion programs throughout the state. The main goal of this was to educate more people on diversion programs, then bridging the gap for individuals with opioid use disorder to get them into these programs, and then promote these programs to legal professionals who have more contact with these populations. And lastly was the response objective. So they wanted to do this through increasing the number of trained first responders, and then also the access to naloxone. So not only just increasing the access for first responders, but also increasing the amount of EMTs and first responders who have training on this naloxone, and then educating the general public on what naloxone is, and then decreasing the numbers of deaths after release from different institutional facilities. So giving naloxone to other supporters, like in the facility, so that they have it on site, medication-assisted treatments in the institutions, and then also linking people to services who are being released. Next we want to look at is the plan working. So the plan was proposed in January of 2020, and of course the COVID-19 pandemic did hit 2 months later in March of 2020 after this plan was proposed. Unfortunately, the opioid overdose deaths have increased by 36% in 2020, with the highest increase being in May of that year, so 2 months after the pandemic, 5 months after the plan was proposed. Emergency department opioid overdoses increased by 17%, and then medical services related to opioid overdose increased by 21% this year as well. Since May 2020, when there was the big spike, totals have decreased and been on a decline, which the most recent data showed to be into February of 2021. And overall, there was an increase in opioid overdoses in many different types of populations, whether that was urban, rural, suburban, and small urban, between the years of 2019 to 2020. And one of the issues with this was that the highest overdose rates were occurring in Black or African American population, especially with the highest in the 45 to 64 age range. The only exception to this was that the white population had the highest death rates from opioid overdoses in the 25 to 34 age group. So some recommendations for these changes, we want to take into account how to address racial and social gaps in the opioid crisis through reaching out and engaging individuals in these communities all the different types of communities to give them access to recovery systems. And then harm reduction strategies. This can be done through evaluating reports of current harm reduction programs in other places that do encourage safe use and release these reports to the public so that they can be accessed. Finding new ways to address illegal drug trafficking can help make a change. This can be done through collaborating with law enforcement to target fatal and then also non-fatal opioid overdoses, especially those that are fentanyl related. Sometimes opioids are laced with fentanyl, which can make it much more fatal. Increasing helpline use. So different helplines can be created for different age groups, whether that's youth-friendly helplines, adult-friendly helplines. There can be creation of online chats and mobile apps to give information and be a resource for this population. And then creating one single website that gives all information that encompasses all, including like state agencies that provide prevention and that provide treatment and recovery services, as well as different information on research and then evidence-based care for opioid use disorder. So as far as my suggestions, I would say that prevention is key. If we can hit the target before people develop opioid use disorders, that is going to be the key in order to prevent these from happening. Otherwise, creating more accessible resources in rural areas and in lower income urban areas can be important because these are the areas that are typically less funded. So finding ways for funding and grants to provide these different resources in these areas, as well as creating a safe space for drug users to be able to relax. A lot of times people rely on drugs because they're not able to relax, so giving them a space to do this, and then having consumption facilities where they can monitor the use, making sure it's safe and in a calming environment as well. My last suggestion is to create a program that can help build relationships with drug users between facilities and then the users themselves, just to kind of start getting them involved, especially targeting the homeless population. A lot of times they have the highest drug usage, so this can be helpful to bridge that gap as far as that goes. So overall, the plan has shown declines since February, but otherwise there was a spike that happened before that, and so hopefully these suggestions